Good day, everyone. I'm Ram Khandedwal. I'm your host today in Dil Se Dil Ki Baat. Today, we have a very special episode. We will be meeting a doctor who's going to talk to us about the modifiable and non-modifiable risk factors related to heart health. And the special guest that we have today is a professor at Amity University, and her name is Dr. Shazina Saeed. I'd like to welcome you, Dr. Shazina Saeed. May
Thank
I
you. Thank you so
request you
much.
to kindly introduce yourself, please?
Yes, thank you so much, Ram. And it's my pleasure to be here with all of you and to talk about modifiable and non-modifiable risk factors. But before I start, let me tell you that I'm a public health professional, and my forte is in preventive cardiology. So although I do not practice cardiology as a clinical science, but preventive cardiology is what is my forte and passion along with prevention of other NCDs. So this particular, when you reached out to me, I was extremely happy that I'll be able to share my knowledge and expertise with your audience.
Thank you. Thank you, Dr. Shazina, for being here with us today. And this entire series is all about having a candid discussion around heart health, and our audience is primarily the heart patients, their families, and people who are at the risk of heart disease. So I'm
Right.
really looking forward to having a very interesting discussion with you today
Yes.
to make create more awareness about heart health, and specifically about modifiable and non-modifiable risk factors. So, Dr. Shazina, let's kickstart the discussion. First of all, please tell us that when it comes to risk factors of heart health, we hear this term quite often, that there are certain risk factors, and I myself uh, have come across this question many times. I'm a heart patient, and I had an episode of heart attack in 2019. And very common question which I get asked, because I had a heart attack at a very young age. I was 33 then. कि क्या हुआ था? So
Hmm.
क्या हुआ था का जवाब लोग चाहते हैं, क्यों हुआ था उसका लोग उस सवाल का लोग जवाब चाहते हैं, और कई बार ये पूछते हैं कि ऐसी क्या चीज़ें हैं जिसकी वजह से हार्ट अटैक आता है।
Hmm.
और जनरली जब हम बातें करते हैं हार्ट डिजीज़ या हार्ट अटैक या हार्ट रिलेटेड इवेंट्स की, तो कई बार ऐसा होता है कि इन 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 डिस्कशंस में लोग पूछते हैं वजह क्या है, और डॉक्टर्स बात करते हैं रिस्क फैक्टर्स की। तो
Right.
इस समय पे मैं एक आपसे चाहूँगा कि आप थोड़ा-सा एक इसमें अगर कुछ हमें हमारे व्यूअर्स को क्लैरिफ़ाई कर सकें कि रिस्क फैक्टर्स एक्चुअली होते क्या हैं? क्योंकि जब भी आप किसी डॉक्टर से बात करेंगे कि एक हार्ट डिज़ीज़ क्यों हुई, तो सबसे पहली चीज़ वो बात करते हैं रिस्क फैक्टर्स की।
Right.
तो स्पेसिफिक रिस्क फैक्टर्स में जाने से पहले आप हमारी ऑडियंस को अगर बताएँगे कि रिस्क फैक्टर्स की जब हम बात करते हैं, तो एक्चुअली रिस्क फैक्टर्स का मतलब क्या होता है?
राइट सो थैंक यू सो मच फॉर दैट क्वेश्चन। मैं सबसे पहले तो एक बहुत ही सिंपल एग्जांपल से स्टार्ट करूंगी, ठीक है? इफ यू लुक एट अ फैक्टर ऑफ और अ रिस्क ऑफ मीटिंग अ कार एक्सीडेंट फॉर एग्जांपल, तो आपके हिसाब से उसका रिस्क फैक्टर क्या है? एक रिस्क फैक्टर है कि कार में सफर ही मत करो, या एक रिस्क फैक्टर है कि रूल्स एंड रेगुलेशंस फॉलो करो, या एक रिस्क फैक्टर है कि आपका जजमेंट ऑफ स्पीड एंड हाउ यू आर टेकिंग द कॉल व्हेन समथिंग अनफॉर्चुनेट इज अबाउट टू हैपन, वो आपका एक नैनो सेकंड में आपका क्या रिएक्शन होता है। सो दीज आर सम थिंग्स दैट आर देयर। नाउ कैन आई टेल समवन टू नॉट travel in a car? I cannot do that. But yes, I can tell them follow rules and regulations so that your risk is reduced. Right. So now coming on to this question of what are these risk factors? These are basically presence of these risk factors or complete absence of these risk factors is not going to judge the fact that you will never get a heart attack or you will always get a heart attack when these five, six factors are present. So, it is a permutation combination, जैसे हम मैथमेटिक्स में पढ़ चुके हैं अपने स्कूल के टाइम्स में. But Generally speaking, for making it very simple for everyone to understand, हम इनको दो broad categories में divide करते हैं. एक होते हैं modifiable risk factors, as the name suggests, आप उनको modify कर सकते हैं. और एक होते हैं non-modifiable risk factors. Now, non-modifiable risk factors में वो सारी चीज़ें आ जाती हैं जो आप change नहीं कर सकते. जैसे कि आपका gender, male female, you cannot change that. So males में usually cardiac risk की या CVD की risk, जो हम cardiovascular disease की risk होती है, हम उसको usually young age से लेके all the way old age तक होती है. But whereas in women, you will find very few young heart attack cases of women, because the the estrogen progesterone hormone का जो balance होता है women में, वो cardio protective होता है. So women की risk बढ़ती है after menopause. Once their hormones are, depleting, जब उनके hormones कम होने लगते हैं तब उनकी risk बढ़ती है. तो हमने अपने mind में as a gender हमने identify कर लिया that if a male is having a risk in his 30s, but being a woman I am protected till 55, 60. So that is a natural thing, I cannot change it. Similarly, age, like for men it is younger age group all the way till older, but for women it mostly begins 65 and above, mostly. Men may, as per statistics, 55 is the highest peak, but uske left right outliers bhi hote hain, so younger age groups and higher age groups are also possible. Then another important thing is the ethnicity, what kind of a background we come from, what are and when I talk about background, I'm talking about, जैसे हम इंडिया में हम सभी इंडियंस हैं, but हम
Correct.
global risk की बात कर रहे हैं. So we are looking at Southeast Asians, we are looking at Africans, we are looking at people from the Caucasian race. तो European race जो है वो relatively protected है, एंड इनके कोई रीजनिंग एज सच नहीं है, ये स्टैटिस्टिकल डेटा है. whatever studies, global studies have happened, right? So that way Southeast Asians, Africans, African Americans, they are at higher risk. So gender हो गया आपका, age हो गया, ethnicity हो गया, and the worst thing or the best thing, your genetics, कि आपको विरासत में क्या मिला है in the form of genes, whether it's good genes or bad genes. So if you have a first degree relative meaning blood relatives like your siblings, your parents, first degree. तो अगर उनके साथ कोई episode हुआ है, तो you need to be well guarded that I am at an increased risk now because my mom, my dad, my brother, my sister was at a certain risk. So I am aware of this risk. जेनेटिक्स में एक बहुत ही सिंपल एग्जाम्पल कैंसर का भी है. जैसे कि मॉम्स को ब्रेस्ट कैंसर अगर होता है तो गर्ल्स को भी होता है. It is generally seen. So they should be more aware, like their guard should be more raised. So similarly for CVTs as well. तो ये कुछ होते हैं नॉन मॉडिफाइबल रिस्क फैक्टर्स. तो जिनके लिए हमें, अब आप बोलोगे कि इसको हम कैसे प्रोटेक्ट कर सकते हैं या इसके हम कैसे, हाउ टू फाइट दिस इज, यू नीड टू बी अवेयर. You need to be aware of your risks for the non-modifiable risk factors. If I'm a woman who is approaching menopause, I should be alert now. Now I should be alert. At 55, I should be even more alert. At 65, I should be more. And then match it with my modifiable risk factors. Now, coming to the modifiable risk factors, there are basically lifestyle things. Everything which is related to our lifestyle. तो इंडिया के सिस्टम में, जैसे पुराने ज़माने में, वी हैव हर्ड दिस इन आवर होम्स, की पहले लोगों की डाइट बहुत अच्छी थी एंड देन दे यूज्ड टू बर्न इट. women used to do a lot of household work. Machines नहीं होते थे, vacuum cleaners नहीं होते थे. We used to do everything ourselves, and that was like working like a cardio. What we now go and do in the gym, these
Right.
normal day-to-day things used to work like a cardio. Climbing stairs, riding a cycle to go from one place to another, etc. But sadly, this is the truth कि हम ऐसे ही world में रहते हैं. And now we have to modify ourselves to suit this lifestyle and fit it in a very comfortable, healthy way. So here we'll talk about, most importantly, diet. Very important. Diet में आ गया वही balanced diet होना चाहिए. Processed foods you should avoid. Foods which are very high in saturated fats, one needs to avoid. It should be a balanced diet of, if you're a vegetarian, whether you're a non-vegetarian, it should be a nice balance. Smoking and alcohol, these are, there are certain guidelines as to beyond what level can be a cardiac risk. So if someone is aware that they are already at a higher risk, or they are at a age where now their risk is increasing, so it is time to say bye bye to certain things. So वो informed decisions हमें लेने हैं. And that is why we are having this lecture, so that, I think everyone tries everything. Everyone's had a good unhealthy lifestyle versus a healthy lifestyle, but we should know when to stop that and when to start this. And another problem that we face is the sedentary lifestyle.
Mm.
Sedentary lifestyle meaning to say that we are extremely busy. We are all ambitious people. We are extremely busy. We are extremely stressed out. And we are like, हमारे पास बिल्कुल टाइम नहीं है किसी भी चीज़ का. तो हम सेडेंट्री तो नहीं है, बट हम फिजिकली सेडेंट्री हैं, हम मेंटली सेडेंट्री नहीं है. इट्स लाइक हैविंग 7 8 tabs open in your head all the time. You're multitasking.
Yeah.
You're under stress. But हम physically sedentary हैं. Physically sedentary क्यों है? Because a lot of our works are now related to being at a laptop. um, you know we try, initially we used to move around for meetings, etc. Now the online meeting system has also made it like we are in a comfort of our offices, and we are able to interact with the world. It has become a very close this thing. Apart from that, we don't find much time for ourselves to exercise or to even sleep 8 hours. Most of us are sleep deprived. So that brings me to another modifiable risk factor, which is sleep. Because, when your sleep is hampered, a lot of the nutrients, a lot of the processes in your body, जहाँ पे आपकी बॉडी रिकवर कर रही है आपके पूरे दिन के स्ट्रेस से, आपके पूरे दिन का जो आपके सिस्टम पे स्ट्रेस पड़ा है, योर बॉडी इज रिकवरिंग, योर ब्लड फ्लो, योर न्यूट्रिएंट्स आर बीइंग एब्सॉर्ब, देयर इज डीएनए टेयर एंड वेयर रिपेयर इज हैपनिंग, वो सब कॉम्प्रोमाइज हो जाता है, whether you talk at a clinical level or whether you talk at a molecular level. तो sleep is definitely very important. और ये सारी चीजें, like don't have caffeine 2 hours before you sleep, etc., etc., these are things we need to start imbibing in our
Mm.
lives. So when I talk about the modifiable risk factors, mostly sleep hai, diet hai, exercise very important. We need to reduce on stress. We need to find times for hobbies. I think, the newer generation, I don't think they even have hobbies, because they just have a screen and they can do everything with it. Whether it's
Mhm.
painting, I mean, whether it's sketching, whether it's playing a game, whether it's listening to music, वो सब कुछ उसी डिब्बे में.
Right.
So we need to find times for hobbies. We need to find for social interactions, because
Mhm.
these are things which boost up your happy hormones.
Correct.
And when your happy hormones are boosted, then there is a lot of negative energy within your body, which is, completely neutralized, if I must say. So these are some of the modifiable risk factors for cardiac disease as well. And one very very important fact would be, जैसे आपने शुरू में पूछा था कि कैसे पता चलेगा, तो there is no warning signs, especially when it's happening among young people. बिकॉज जब ओल्ड में होता है तो कहीं ना कहीं एक एक्सपेक्टेशन होता है कि अच्छा, सो एंड सो इज 55 60, सो अब तो इनको ये सब होगा. But when you're 30, when you're 40, you don't expect things to happen, and it really truly surprises you and takes you by surprise. So we need to make sure कि हम ये annual checkups के लिए जा रहे हैं, हम कार्डियोवैस्कुलर रिस्क के लिए स्क्रीनिंग कर रहे हैं, हम हाइपरटेंशन के लिए स्क्रीनिंग कर रहे हैं, हम डायबिटीज़ के लिए स्क्रीनिंग कर रहे हैं. And when the results come out positive that you are negative for so and so risk, then you must actually treat yourself and say, I'm going to follow all the things that I followed this year and go back next year and make sure that I'm healthy again. right?
Right.
So
Yeah.
these are, in my view, I feel that knowing your risk because of the lineage and the family and the ethnicity and gender, and then trying to identify all the things that you do in life which you can change, and then looking at screening protocols. So ऐसा नहीं है कि अगर आप सिर्फ हेल्दी डाइट लें और वेट वॉच करें तो आपको कोई रिस्क नहीं होगा. So
Correct.
for
Correct.
that reason, screening is important. Hospital appointments are important. Blood values are important. So we also need to focus on that part of it.
Correct. And Dr. Shazina, I'd just like to add here. You mentioned that there are no symptoms, and secondly, people often think कि overweight है तो risk है.
Hmm.
But actually, इट इज़ वन ऑफ द रिस्क फैक्टर्स. बट जब हम एक हार्ट डिजीज की बात करते हैं या सीबीडी की बात करते हैं, तो इट्स ए कॉम्बिनेशन ऑफ मल्टीपल रिस्क फैक्टर्स, लाइक यू हैव
Yes.
राइटली सेड, इट्स ए परम्यूटेशन एंड कॉम्बिनेशन. तो
Right.
आपको 10 में से हो सकता है 2 रिस्क फैक्टर हों, बट बाकी 8 ना हो, बट फिर भी वो रिस्क फैक्टर की अगर इंटेंसिटी ज़्यादा है, तो आपको
Right.
कार्डियोवास्कुलर डिजीज़ हो सकती है. कई
Right.
बार लोगों के साथ ऐसा होता है कि वो पतले-दुबले होते हैं. फॉर एग्ज़ाम्पल इन माय केस, व्हेन इट हैपेंड, I was almost at a normal weight. I was never overweight. So just by looking at my appearance, nobody could say that I had high level of cholesterol.
Right.
And many people these days, when they see their blood reports, they think कि हम अपना डाइट चेंज करते हैं, हम अपना एक्सरसाइज करते हैं, और इससे हमारा कोलेस्ट्रॉल कम हो जाएगा. They get into this routine, and sometimes they put themselves at more risk, because what happens, people without knowing their internal condition, without consulting doctors, start this
Yes.
extensive regimes which puts
Yes.
them under a lot of stress.
Yes. Yes.
And they find it, they are putting already जो उनके, because heart is like a motor ना, so
Yes.
it's pumping the
Right.
blood inside the body. So we are stressed motor को हम और ज़्यादा stress दे देते हैं without checking how much stress we should be giving to it.
Right.
So like you rightly said, that screening is very important. कि
Right.
आपको अगर अब पता ही नहीं है आपके अंदर क्या चल रहा है, तो आप उसको ठीक कैसे करोगे?
Absolutely.
तो ये एक बहुत इंपॉर्टेंट फैक्टर है मेरे ख्याल से, जो हम कहते हैं 20s 30s 40s में जो जनरेशन है, जिनको साइंस बहुत ही कम दिखते हैं और फिजिकल अपीयरेंस से बताना बहुत मुश्किल है. आई थिंक स्क्रीनिंग इज द फर्स्ट गो टू थिंग विच आई फील is also very important, and I am glad that you also highlighted and pointed out that fact. So, Dr. Shazina, this interview I was watching the other day, and one of the statements which was being discussed, sitting is new smoking. So, tell me some of your thoughts about it.
Yes. It is actually very true. And the worst thing is that I'm including myself into it, that sometimes you don't realize that you've been sitting for 2 hours because you're so engrossed in your work. You don't realize that it's been 3 hours since I drank water. I got up and I took a glass of water and I had that. So it is indeed, it is doing worse to your body while you are in a sedentary coop for yourself. So it's not just for weight gain, but it is also for regular physiology of the body to take place. Like, for example, I'll tell you, um, for women, obese women, यूजुअली उनके यूट्रस बहुत बल्की हो जाते हैं, एंड बाय द टाइम दे रीच मेनोपॉज उनको हिस्टेक्टमी करने की ज़रूरत पड़ जाती है. वन ऑफ द मेजर रीजंस इज प्रोलॉन्ग्ड सिटिंग. आई मीन, कैन यू बिलीव दैट? समथिंग एज सिंपल एज just taking a walk around. So, someone, whoever has said this very rightly, that sitting is the new smoking. It is true. It is a lot. It is adding to a lot of risk factors. And plus, when you're sitting and the sedentary lifestyle, and you have this tendency to gain weight, uh, also please remember that obesity is the root cause of most NCDs, because that is what is slowing down your metabolic pathways. And since we are discussing this, I would also like to bring over here the talk about what are metabolic risk factors. So, we talked about modifiable, non modifiable, but then there is something which is called metabolic. Now, what is metabolic? Metabolic is when you have a combination of things which could be a recipe for disaster. And uski starting point, initiation, in most cases, whether it's diabetes, whether it's hypertension, whether it's CVD of any other kind, is obesity. एंड हम लोग यूजुअली क्या करते हैं, हम लोग ओबेसिटी को मेजर करने के लिए BMI का यूज करते हैं, which is not a fair judgment, because if you're comparing a truly overweight person with a normal built person with heavy bones, you could categorize that poor guy into a obese category as well. तो ये जो सिटिंग है, ये हमारे जो एक्चुअल वे ऑफ measuring your body, your weight for your body, is the hip waist ratio. So when you do prolonged sitting, you start gaining weight on those certain areas where your hip waist ratio gets perturbed, and as a result, this is leading to more risk. So in men, it is always the central obesity around the girth, and in women, it is mostly the lower body obesity, which is a problem. So yes, that is definitely something that we need to account for. And talking about the metabolic risk factors, there's another thing. Aajkal, adolescent obesity has increased in India. This is the new problem. And if you just look at the population of adolescent obesity, you can do a predictive analysis and tell what will be the burden of CVD in India in 2050. Because
Correct.
these kids are going to be at 2 times the more risk by the time they reach 40, who are right now 12, 13. And here, let me point out that, there are certain metabolic cascades in the body, जो metabolic processes हैं. Now, suppose if there's a child who is extremely obese, who is taking processed food, who is not having a healthy lifestyle, who is being a sedentary child, वहाँ पे एथेरोस्क्लेरोटिक चेंजेस या आपके कोलेस्ट्रॉल से रिलेटेड बॉडी चेंजेस, या जो भी ये मेटाबॉलिक चेंजेस हैं बॉडी में, ये स्टार्ट हो गए हैं, ये कैस्केड स्टार्ट हो गया है. Now suddenly if that child decides to go into working out and doing all that by the time he's 21, 23, उसका वो रिस्क वहां पे स्टॉप नहीं हुआ है, मे बी अरेस्ट हो गया है, मे बी स्लो डाउन हो गया है, बट प्रोसेस
Correct.
इनिशिएट हो गई है. So you cannot do all the all the things you want in life and then go back to being a saint.
Absolutely.
You need to have that disciplined lifestyle right from the beginning, of how we are inculcating in our kids that there is a little bit of outdoor play important, there is a little bit of ठीक है, junk food only once in a month. Kids will ask for all these things, but
Correct.
हमें इन चीजों का भी ध्यान देना है. So
Correct.
yeah, so sitting is definitely killing us all.
Correct. And
Yeah,
Dr. Shazina, I think a very important thing which you said that when we change lifestyle, or let us say we go on medication, we reduce the intensity of what was going wrong, or maybe stop that. But whatever has gone wrong. It stays with
right,
us.
right.
And I'll give you an example, ma'am. I was talking to one of the patients in our community. Uh, that gentleman had a cerebral attack,
Hmm.
stroke. After 12 months, he was diagnosed with 90% blockages in heart, and he went through a bypass surgery. And when he asked his doctors that I've been taking the course of medication is quite similar when it comes to
Right,
stroke and heart attack. When it comes to he was on blood thinners and other cholesterol reducing drugs. So for 12 months, he took those drugs, but still he was at the risk of heart attack. Uh, at that point of time, the doctor said that, see, for last 12 months, these things have just delayed your onset of the event and kept you safe. But whatever has gone wrong before that is actually causing what is happening right now.
Right, right,
And another doctor I spoke to, they also told the same thing कि जब आपका स्टेंटिंग होता है या बाईपास सर्जरी होता है, तो वो स्टेंट जो प्लेस किया गया है वो उस एक पर्टिकुलर आर्टरी में किया गया है, एक पर्टिकुलर पॉइंट पे किया गया है उसको क्लियर आउट करने के लिए. बट उसी आर्टरी के अंदर बिफोर दैट आर्टरी और आफ्टर दैट आर्टरी और इन अदर आर्टरीज विद इन द हार्ट, there is still a lot of cholesterol which has been deposited. So that risk still remains. So
right,
आप उसको reduce कर सकते हैं, but if you start focusing on your modifiable risk factors, so without even reaching that stage where you are at the risk of doing a surgery or a procedure, आप उससे पहले ही उनको उस stage तक जाने से रोक सकते हैं. So that's
right.
actually a very important message, and especially from the young folks' perspective, that
Yes.
the kids who are not in a healthy lifestyle right now, they should kind of start going towards a healthy lifestyle, because modifiable risk factors, as the term says, modifiable, आप उनको
Right.
ठीक कर सकते हो.
ठीक
तो
कर सकते हो एंड ऑल्सो इट बिकम्स अ पार्ट ऑफ देयर जनरल लाइफ. तो उनको
करेक्ट.
अगर उनको 30 मिनट की वॉक काम नहीं लगता, हमें आज के टाइम पे काम लगता है, बिकॉज इट्स लाइक आई नीड टू डू दिस. बट
या.
if you have a child who is into sports, who's into outdoor activities, who studies a little and plays a little, etc., तो उनके लिए ये अलग से काम नहीं है. They're used to it. So I'm
करेक्ट.
actually so glad how yoga has been integrated at all these schools now, because my children do asanas as easily as they would play and do anything else.
या. या.
तो वो inbuilt हो गया है उनके अंदर. So it's actually
वंडरफुल.
these are the things we need to start doing now
So,
to
ma'am,
get them that.
can you share some quick tips with our viewers? क्योंकि modifiable risk factors हैं, उनको हम modify कर सकते हैं. तो बहुत ही सिंपल सिंपल सी चीजें जो वो अपने लाइफस्टाइल में कुछ चेंज कर लें, जिसकी वजह से उनका रिस्क कुछ रिड्यूस हो जाए फॉर हार्ट डिजीज.
See, I'll tell you very practical ones. See, by
या.
saying ki eat a balanced diet and do this and do that, sometimes it may get a little overwhelming, because you can't suddenly rotate your life 360 degrees. But
करेक्ट.
there are certain things that I follow in my family, like we eat out only once a month. We don't eat out. If suppose if there is no food, or there is the cook has not come or whatever, we'll have dal chawal, but we will not order from out. So this is one thing that we follow as a family, that we are having ghar ka simple khana. Salads are supposed to be an integral part of your diet, because you need to add a good amount of fiber to your diet. For kids, it's no to processed food, and junk food is only once a month, or if it is your birthday. So so these are a couple of things that we do. um, I feel it is a good starting point, and then when you get into the habits of it, then obviously things get easy. Like, a lot of my people in my home, in my seniors at my home, they take the golden milk, which is your turmeric milk. They say it is a one stop solution to many problems. So there are lots of things like that one can keep educating themselves. It's like an ocean of knowledge, and you can start going back. But going back to the Indian roots has truly been, I think, the most beneficial experience for me, because I think it's simple to follow. The ingredients are not expensive, so that it is sustainable. You know, if I prescribe a broccoli to you, how long are you going to eat it? You may one day say कि नहीं बहुत महंगा है. One day you may give up on it. But if it is something which is a part of our staple, uh, you are more likely to follow it for a sustainable period. So these are some of the tips that is there, and of course move around. So there are times when I'm on the laptop for a very long time, and what I do is I have made a sort of a pedestal which is at a height where I can stand and use my laptop. So sometimes I feel like I take those on purpose, I take those breaks. So all those who are working at the laptop and at the table, you could devise something like that for yourself, where you are doing a little bit of walk. Even if you can't walk, even standing and working on a laptop is also you're burning calories. So small pointers like that, which I feel are practical to follow.
That's wonderful, Dr. Shazina, and I think these are very practical and simple tips because the ingredients or staple food you talked about are something which are at our disposal very easily.
Yes,
So
yes,
we can actually follow it without making a lot of lifestyle in our busy schedules. And simple things, just maybe uh, buying a grocery, you don't always need to do Blinkit. Maybe if you have time, you can just walk
yes,
down and
yes,
get something. So it's also good for your health. It if you are moving around, uh, people think of gym and heavy exercises as a way to remain fit. But even simple walking and going to places on foot or by cycle is something which can actually help your physical improve your
yeah.
physical activity.
Right, very rightly said. Very rightly said. Yes.
Thank you so much, ma'am, for joining us today. And to our viewers, I'd like to say that we'll keep bringing speakers to you like Dr. Shazina, who are experts in their fields, and also stories from our fellow patients and caregivers to create more awareness around heart health. And if you have any suggestions, and you would like to know any questions or you have any doubts in mind, please do share it with us. We'll try to get answers to these questions and post it across on our channels. And I'd like to thank Dr. Shazina for being here with us today and enlightening us.
Thank you
Thank you,
so
Dr.
much for having
Shazina.
me.